record-breaking temperatures, the dangers of scorching heat, that's been the story of the summer, which can make it easy to forget that in Britain, the cold can be just as biting. Every year, more people die in the winter than the summer, and the data tends to follow a particular pattern. If we look at deaths from all causes in cold weather, we can see excess deaths are lower in less deprived areas. And while deaths from heat waves tend to be higher in cities, in the cold, it's rural areas that are more vulnerable. Age is also a factor. Research suggests those over 85 have more than twice the risk of dying in cold conditions compared to those under 64. But we can make a direct link between the temperature of our homes and our health. One study found excess winter deaths were almost 3 times higher in the coldest homes compared to the warmest.
You know, it was estimated 2 years ago, so pre-COVID, if you like, that there were around 360 people who died across the northeast purely as a result of living in a cold home. At a national level, it's probably 8,500 in a normal winter, and we know that this winter is not going to be normal.
It's not just the risk of death that's linked to cold homes. There are long-term conditions too.
I think people often understand the link between, cold homes and worsening conditions in older people, such as cardiovascular disease or arthritis even. Actually, what people tend to know less about is the impact that it has on our children and our young people. And actually, there is evidence that suggests that if you have a young person growing up in a cold home, that they're 5 times more likely to experience mental health disorders than those young people who grow up in warm homes.
As energy prices rise, the risk of health impacts is not helped by the fact many British homes don't hold the heat. On this map, green shows the most energy efficient homes, but you can see large patches of orange where the average efficiency is band E, particularly in the north of England, Wales and the southwest.
The UK has some of the worst housing stock in Europe. It's harder to heat, it's more expensive to heat, and it loses heat faster than almost anywhere else. So if you're in that really wicked combination of circumstances on a low income or even a middle income with a susceptibility to the cold because of age or a pre-existing medical condition, and you live in an energy inefficient home, well, unfortunately, that's the worst of all circumstances. And that's why it's not just about cost of living. There's a cost in lives. It has a dramatic effect on the NHS and on the health of the nation.
The NHS is already creaking under pressure. The numbers waiting more than a year for treatment are almost 300 times what they were in 2020. Poorly heated, cold homes look likely to add demand. The NHS Confederation wrote to the Chancellor a week ago, raising concerns about how the service will manage.
The simple fact is, unless substantial action is taken on energy bills and taken immediately, the NHS will find it incredibly difficult to cope with higher energy bills for the health service itself when our resources are already stretched, to cope with the impact on our low-paid staff, and we already have 105,000 vacancies and staff who are finding it incredibly hard to make ends meet, and particularly the impact on the populations we serve. Without taking action, we're going to have sicker people, we're going to have staff who can't afford to pay their bills, and we're going to have hospitals which are running short of money because of their spiralling energy bills.
Rising energy prices are often portrayed as an economic crisis, but the very human consequences mean they could quickly become a public health crisis too, one that we need to think about now, while the sun is still shining.